Holidays are winding down. More people are heading back to work and school, and unfortunately, some are bringing back an unintended gift. Viruses. Local hospitals say they're starting to see increases in COVID, flu, and RSV. So how bad is it, and what can you do to protect yourself? Jess Arnold joins us live. Jess is at MedStar Washington Hospital Center in Northwest DC. And Jess, you spoke with two doctors. What are they telling you?
Yeah, well, I asked them how they're doing in terms of capacity, and the doctors that I spoke with said patients still have been able to get the beds and appointments they need, but they are seeing that uptick in respiratory viruses. And I just checked health department data this morning, and it seems to support that. Now, I asked the director of infectious diseases here at MedStar Washington Hospital Center, what they are seeing going into this year, how it compares to years past, and this is what he had to say.
Since 2020, I don't think we've had a typical year. That first year flu sort of went away, probably because everybody was masking. And I think right now this is what we've seen with flu in the pre-COVID era. We would always see a bump up with flu. And then COVID is still trying to figure itself out, whether it's going to be a winter virus, summer virus, none of us really know right now. We seem to see episodic ups and downs with COVID.
Dr. Glenn Wortman said RSV is also typically a blip in the wintertime, and that's starting to be more at pre-pandemic levels as well. In D.C., the Department of Health data shows flu case rates mostly increasing leading up to the holidays, but there's no data for the last few weeks, and they have COVID transmission rate low for this past week. Maryland has seen a pretty steady increase in COVID cases from the fall to the holidays and has flu illness activity listed as high for the week before Christmas. Now, for that same week in Virginia, the Department of Health reports flu activity as very high, with one recent pediatric death and COVID-like illnesses making up about 12% of emergency department visits. So I asked Kaiser Permanente internal medicine physician Dr. Ashley Williams what we should all be doing to protect ourselves from these three respiratory viruses.
You're having fevers, chills, body aches, cough that's severe, you want to go ahead and stay home so that you can prevent spreading any kind of upper respiratory infection to others. And if you're going to be in a crowded space where, you're not as familiar with the crowd, or it's a possibility you could be around someone sick, masking is still a great option.
Yeah, I don't know about all of you, but I have certainly been pulling out this mask the last few weeks when I have been traveling for the holidays. Now, these doctors also said that vaccinations are still worth getting, both the COVID and the flu shot. They say if you have not done that yet, you should get it. Now, I'm going to talk about vaccination rates that we are seeing across the region coming up at 6:30, and also talk about what these doctors are saying about if you can tell which virus you have, how you might be able to. We're going to break all of that down again coming up at 6:30. Guys.